Hi, Roberta. Thanks for coming in on time.
Thanks.
How are you?
Good.
Would you like some coffee or water?
No, thank you.
Do you remember where the bathrooms are?
Yes.
Okay. Before we get started, did you bring in your insurance card and your identification card?
Yes.
Okay, I'm going to be making some copies, and we'll be signing have you sign some consents for anyone that you would like involved in your treatment.
Okay.
Okay. I'm going to ask you a few questions about your use of alcohol and other drugs during the past 6 months. Your answers will be kept private. Based on your answers to these questions, we may advise you to get more and complete assessment. This would be voluntary. It would be your choice whether to have an additional assessment or not.
Okay.
Okay, and during the past 6 months, have you used alcohol or other drugs?
Yes.
Have you felt that you used too much alcohol or other drugs?
Yes.
Have you tried to cut down or quit drinking or using drugs?
I tried to cut down.
Have you gone to anyone for help because of your drinking or drug use?
No, this is my first time.
Okay, have you had any following blackouts or other periods of memory loss?
No.
Injury to your head after drinking or using drugs?
No.
Convulsions or delirium tremors, it's DTs?
No.
Do you have hepatitis or other liver problems?
Yes.
Feeling sick, shaky, or depressed when you stop drinking or using drugs?
Yes.
Injury after drinking or using drugs?
Yes.
Using needles to shoot drugs?
Yes.
Has drinking or other drugs use caused problems between you and your family or friends?
Yes, a lot of problems.
Has your drinking or other drug use caused problems at school or at work?
Yes, I lost my job. I haven't been working in about 1.5 years.
Have you been arrested or had other legal problems?
Yes.
Have you lost your temper or gotten into arguments or fights while drinking or using drugs?
Yes. Yes.
Are you needing to drink or use drugs more and more to get the effect you want?
Yes.
Do you spend a lot of time thinking about or trying to get alcohol or other drugs?
Yes.
When drinking or using drugs, are you more likely to do something you wouldn't normally do, like break the rules, break the law, sell things that are important to you, or have unprotected sex?
Yes.
Do you feel bad or guilty about your drinking or drug use?
Very much so.
Has anyone in your family, any of your family members had a drinking or drug problem?
Yes, there's a couple of them that are sober now, and they're very supportive of me.
Do you feel that you have a drinking or drug problem now?
Yes.
Okay, well, is there something that I can do for you to help you today?
Yes, what I really would need help with is to get into an inpatient program. You know, some folks told me about inpatient, but I really don't know that much about them. And I just think I need to be in. I don't want to be, you know, out here anymore.
Okay,
I need some help.
Well, would you feel more comfortable in an all-female versus a co-ed facility?
Yes. Co-eds, that's like men and women?
Yes.
Yeah, female. I want all female.
Okay. If the treatment center is a far distance, would you be willing to go there?
Yes.
Okay. We could have a van pick you up.
Oh, very good.
Probably at your house.
Good.
Okay. Are you interested in a drug replacement therapy, or would you prefer a drug-free environment?
Okay, drug replacement is like the Suboxone or that for treatment. No, I want to try this drug-free.
Okay, well, based on this information, I'm going to look into some inpatients that your insurance covers. Do you have any current medical issues?
No.
Okay, congratulations. We're going to get you into treatment. This is a big step.
Okay.
And if you feel you need to contact me in the meantime, before we get you into treatment. Would you be willing to go to a few meetings?
Yes, I'll go to a meeting or two.
Okay. Well, I have a list for you, and my number is also in here.
Okay, thanks.
You're welcome. Okay, and in this assessment, I attempted to incorporate social work skills by collecting client data, explored presenting problem, explored strengths, facilitated transitions and endings, made the client feel comfortable, and in the next interview I'll work on treatment planning.